Hi, my name is Dori Kleesis, and I'm with the Mount Sinai Health System in New York. Today I'm with Dr. Projak Singh, the director of the Arnold Institute of Global Health at Mount Sinai. Dr. Singh, thank you for being here.
It's wonderful to be here. Thank you so much, Dori.
So I'd like to start with asking you about the mission of the Arnold Institute of Global Health at Mount Sinai.
Thanks. The Arnold Institute for Global Health is focused on community health, both abroad and domestically, and we're really focused on building both technology, care models, and training that allows us to scale health impact across the world.
And what have you learned outside of America that perhaps you brought here to help us in terms of healthcare models?
One of the things that's really impressed me throughout my career has been what is the impact that rapidly trained community members can make if they're equipped with cell phones, diagnostics, and training, and part of a system that community health workers can play a very important role in connecting communities to health systems. And so over the last 10 years in America, that trend is starting to catch on. What's the role of lay people or people in communities to take part in their own care? And that's becoming increasingly important as we start to think about hospital care beyond the walls of hospitals.
And in terms of Mount Sinai, have we moved to some of these new models of care? What are we doing that maybe mirror other countries, or that maybe other countries are learning from us?
Well, one of the things that's most exciting about Mount Sinai is that we've put a stake in the ground about making sure that we're not just focused upon care in the hospitals, even though we want to do that excellently. We want to actually make sure that you're taken care of wherever you live, work, and play. And as a result, we have to think about new types of staff, new types of stuff. What are you going to actually do in homes? New systems. How are you going to support somebody who's maybe moving around a neighborhood? And new spaces for care, communities and households. And so over the last few years, I've really seen Mount Sinai put a huge emphasis on how are we going to actually build these things. And that forms the basis for a really constructive exchange with countries that may have already started to take a leap forward on that front, like Brazil, for instance, which has family health teams that move around neighborhoods and take care of people while connecting them back to care when they need it most.
Do you think if we adopt some of these models in America, it'll help cut our costs and increase quality? Because right now many people say we might be bankrupting America with healthcare costs in the future.
Well, I think, so absolutely. One thing that has happened in the past is that sometimes we wait for people that, for example, have early stage diabetes, and their condition advances and it gets worse, and then ultimately we're taking care of them in the hospital. I think we all can agree that there's obvious opportunities to take care of them at a much earlier stage and also equip them for their caregivers and their community support to take part in their care. It means that we will do things that are earlier, more targeted, and simpler, hopefully. And that leads naturally to higher quality of life, and lower costs for our country. I think one thing to add is that a lot of countries have just recognized that you really need to be able to grapple with the social conditions that people live in as well. And so if somebody's struggling at home, it's hard to give them very complicated healthcare directions. And so what I have really appreciated over this last few years is a really serious dialogue about what is the responsibility of healthcare and how do we encourage society more broadly to make sure that people are in the best position to take care of themselves.
So are you training healthcare workers in that model to look at socioeconomic conditions in our own neighborhood of Mount Sinai?
We work with partners, community-based partners, not only at Mount Sinai, but actually abroad as well. And what the role of the Arnold Institute is to actually help is to enable the doers, to help build either technologies, help clarify their work, exactly how the care models come together, and then make sure that we're also learning what does the next generation of training look like. And so we see ourselves as supporting the doers and building things with and for them, along with general knowledge and research that we think might be relevant to other people that aren't immediately here with us on this journey.
All right. And the American life expectancy is the same as it was in the 1970s for Americans. Why is that?
The American life expectancy for the bottom 10% of Americans is the same as where the rest of the country was in 1970. That's really alarming. It means that for people that are struggling most in this country, they're not experiencing the breakthroughs, both in innovation and technology, but also in basic elements of care. And so for this 10% of the country, we really need breakthroughs. We need a fresh look at what we can do. And that's where we really think that looking abroad to our partners that have made huge strides in life expectancy, there's a real opportunity for exchange. The things that we've learned is that settings in global settings really take seriously a very well-organized community-based workforce. They really clarify covering everybody in a place. They really focus on lightweight, very easy to use technologies that connect everybody. And finally, there's a constant dialogue with communities about what are their highest priorities.
So one example, to bring it down to the level of an example, with the Ebola crisis, in Africa, didn't they actually know exactly where in what villages there were outbreaks because of cell phones and technologies, and then they were able to dispatch workers exactly to that location?
Well, what's interesting is that during the 2015 Ebola outbreak in Liberia, it was a wake-up call because all of the things that you just mentioned that we should be able to do, it took a long time to get them in place. What's really heartening is that right now in the DRC, there is an Ebola outbreak right now. And I do see signs that we're picking up those lessons from 2015 and starting to be more targeted and starting to be better partners with our communities so that they can help tell us where to go.
So a lot of lessons learned, and hopefully we'll bring those lessons back to America to help us in the future.
That's my hope, and my hope is that we're in constant dialogue about how to make some of the same things that we're working on, both domestically and globally, and we're improving them together. I think we have a lot to share from what we're doing here at Mount Sinai, and we have a lot to learn.
Thank you, Dr. Singh. Thank you for joining us.
Thank you so much, Dory.
Okay.
Yep.